Okay, so I did put together an agenda, some of the topics I'm going to cover. I hope that this afternoon you'll take away a nugget or two that helps you in your business. And the agenda that I have, we're going to define the scope of services, what are your goals, and this is stuff we should be doing. You got to do it with purpose, right? If you're going to buy stuff, let's set some goals. What's my goals with purchasing equipment? If it's just transactional business and you go buy from, as I call, Joe the Ragman, that's a problem, right? That's a problem for our patients. It's a problem for your employer. And then we'll talk about total cost of ownership, patient safety, clinical quality, compliance, regulatory compliance, identifying top vendors and going through spend analytics, how you select business partners when you monitor and assess it, because you want to make sure you're meeting your goals. So the first thing is your scope of services. What kind of a program are you? Are you just biomedical services program? Okay, you have a very small select things that you need to purchase. Do you do imaging? Do you do radiation oncology? Are you doing biomedical device integration? You're touching the network. So that all of those subsets are subsets of different purchasing behaviors. You're going to go to different vendors. Maybe your organization is hooked up with buying groups, so you want to be cognizant that you're maybe compliant with what they want to do. We're an HPG, Health Trust Performance Group. We're an owner, one of the owners of HPG, so they like to feed all that stuff through HPG. But when I first got there, they're like, I started ordering from different vendors. Well, they're not in our system. They wanted me to go through the process of getting that vendor to go to HPG. While that's great and everything, some of the vendors that we deal with, not necessarily very large vendors, to go through the HPG process is very complex, and you're going to give up margin because they have to get their cut, because owners like us want to get our cut at the end of the year. So you have to be cognizant of that stuff. Make buy. Does anybody understand what I'm trying to say there? So you, as a healthcare technology management professional, you make decisions every day on whether you're going to make the service with your own hands or you're going to buy the service. So you got to understand, what are you making and what are you buying? Maybe there's a certain subset that you have skill sets in-house and you're doing it with your own hands, and then you're going to buy outside labor. You're going to contract that, you're going to do it transactionally. Service delivery plans, especially in heavy iron. So service delivery plan, hopefully you all are into service delivery plans. I'm really into service delivery plans. Where's Ben? There's Ben. We were having a discussion last night at the table, and about committees, right, Ben? So I'm not a committee guy, but what I do is I meet, or my regional directors meet with all the imaging directors, right? That's what I call the heavy iron clinical lab, right? Some of those heavy iron. So, and what we do is we put together a business plan for their delivery and service for their systems, whether it's the CT or the MR. We're going to put together a service delivery plan. And, if we're not doing the service, okay, we're going to contract it with the OEM or maybe a third party. Our hours are such and such, all that great stuff. And then also from your parts. Where are you going to get parts from? If you're in endoscopy, where are you going to service your scopes at? Are you going to service it through the OEM, or are you going to service them through a third party? So you're putting together service delivery plans so they all know how it's going to go. So there's no questions. There's no like, oh my goodness, I saw this guy come in and he wasn't wearing a shirt with a meatball on it. I don't like him touching my stuff. So, and again, the endoscopy stuff, we want to make sure we have all of our inventory of scopes in our enterprise asset management software. If you do have problems with convincing your endoscopy leader about using a third party, real easy program to put together. again, you manage the service, right? And when they give you a scope that they say has a problem, is broken, then you have relationships. Maybe you have it with the OEM, or you have it with a third party because your group purchasing organization has a good contract with a third party. Maybe it's NMS, scope repair, right? Or you're going to use the OEM. So you're not going to tell her, though, where you're sending the scope, or him, where you're going to send the scope, right? And that's how I was successful in starting an endoscope management program. Because the spreading of the hate and discontent by the OEMs is terrible, right? So they're going to show pictures of tape, electrical tape, and wraparound stuff inside the endoscope, and believe me, I've seen it all. So the deal was, you give me the scopes, I will use your OEM, but I'm also going to use a third party. When you have a problem with an endoscope, you tell me what the problem is, and I will tell you where it was sent last. Now, if it's 3 years later, guess what? That's not legit, right? So anyway, that's just a little bit about service delivery plans, just so everybody knows. And what's your organizational implication? I talked about group purchasing. You gotta play ball, right? It's like buying monitors, right? My company signs a big contract with X monitors, and I don't like it. I like my. Guess what? You gotta play ball. So. All right. Goals and priorities of strategic purchasing. Is your only goal to save money? Because mine's not. Mine's not. My only goal, of course it is a goal, but I'm kind of expecting those partners that I'm partnering up with to be competitive. But I'm not the cheap guy, right? I don't buy cheap. And I see it every day. Some of my peers, no one here, of course, but they'll send a $40,000 endoscope out to Joe the rag man who's in his garage trying to re-engineer the scope to get it repaired. So we don't do that, right? We don't want to do that. If you're being sold like that, if your purchasing person comes in and is trying to sell you cheap, 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 I usually don't buy from somebody that's selling me cheap, 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 right? Because that's not my primary target. My primary target is quality, and my patient safety, right? That's the first thing I'm looking for. Do they have to have ISO 1345? I look for that. That's a big plus sign. That's a big deal, right? But it's not the only deal. If they can show me they have a quality management program in place, I'll buy that, but I'm going to go over that quality management program. A lot of times, since my program is nationwide, I have the opportunity to travel all over the country. So with my partners that I select, I go to the facility, right? I usually try to drop in and visit with them. And of course, they take you into the boardroom, and you're meeting with all these suits or whoever in the room. And after the formalities, I said, you know what I'd like to do? I'd like to go out into the shop. I want to talk to the people that are fixing my scopes. And I talk to them, because if they're miserable, if they need their job, they don't want to send my scopes in. So, and it's the same thing for whether it's, there's so many, whether it's 360 biomedical, PM biomedical, all of these USOC, Tenacor, I want to see what they're doing. I want to see what they're all about. Do they care, right? Because I care. I want to make sure they're caring just the same, and they have the patient focus. In the end, it's just not a job, and I'm fixing stuff. So that should be a goal. You want to make sure you have a goal where you're sourcing with high quality partners. What is your priority? For my employer, it's not to be on the evening news because somebody was hurt because I used a third party part, or I used a third party service or something. Now we get into spend analytics. So this is a big deal. And how do you capture spend analytics? Now the beauty, when I set up my enterprise asset management software, what I like is that my technicians have to order parts for the device they're working on in my enterprise asset management software, right? So there's a purchasing module maybe in your product, whoever you're using, and I make them order parts through there, right? We can't order parts for any devices outside of that system. Now they can order stocking, but like batteries and other things, you order stocking, but they use what they need, and then the rest goes into a warehouse. And when they're used, because I'm capturing every single penny that I'm spending on those devices. That is my ultimate goal, is to capture every single penny. Even service agreements, right? So this is a big deal, depending on your enterprise asset management software, because let's say you have an MSA. We have an MSA with GE or Imaging. So it's a big number over a lot of equipment. You got to be able to make sure you break it apart so that the cost of that service agreement isn't the full nut for all the equipment for every device that's covered under that agreement, right? Because I'm going to pull reporting out of that to say how much we're spending on a device. So I want to be able to tell my leadership, my corporate leadership, as well as the hospital leadership, okay, we have Canon Prime 160 CT scanners. I want to tell them to the penny how much it costs to support a Prime 160 CT scanner. Because I want us to make good purchasing decisions, not emotional purchasing decisions, right? Just because some doctor, I like Siemens. If you have a strong standardization program, when they make a decision they want to buy a CT, great. Here's the Canon CT book. Which one would you like? And of course, then we'll argue about, well, I like the 640 slide CT scanner. Well, you're a little community hospital. You don't need a 640. We'll get you the Prime 80, a Prime 160, or so. But that's what I'm trying to eliminate. So I'm trying to work my spend analytics into making decisions, purchasing decisions, capital purchasing decisions. I want my leadership to know the kind of detail of what we bring to the table, what we're bringing to the table for value proposition, right? And we get that through analytics. Where are you gathering the data from? That, if you're not doing it through if your techs are not ordering through your enterprise asset management software, then you got to figure out a different way to get it from your ERP, right? Here's a suggestion. If you're buying parts for your biomedical devices, make the POs have a leading prefix for your POs. Maybe B for biomed, blah 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 11. You'll have to work with your finance department and get that all. Maybe it's CE and then the number, or however your POs are structured. But I have to identify what the spend is, right? And if you're lumped in, like the first day I started at CHS, I'm going to get spend data, and I said, can you just do a pull out of our, we have Oracle financials. Can you just do a pull out of Oracle? And, they gave me 87,000 line items to look at. I was like, here, sure, any money? I'm going to put it. Well, when I first started looking at them, there's very little detail. Well, right? Just in part. Doesn't say what kind of part. I couldn't tell the difference between a consumable, like a cuff that we may have bought, right, which I don't want to capture, versus a part. So I would, again, try to, if you don't have your text ordering out of your system, then try to have a strategy. Work with your finance team to have a strategy on how to identify your POs. What role does your enterprise asset management play in your analytics? I got an EAM guy sitting in my front row. I've got one in the back. Anybody else in here have a CMMS product? I was in supporting this meeting. There were a couple of others. So that's a big deal because that's where all of my reporting gets generated from, is my enterprise asset management. I usually, if I'm using Power BI or Tableau, so I'm creating reports, because my senior leadership doesn't want to see a report typically out of the enterprise asset management software, because there's usually a lot of verbiage in there or things like that I want to just give them the nuts and bolts, a picture. A picture tells 1,000, the picture says 1,000 words or something like that. So that's what I want to do. I want to make it a picture. So I use Tableau or I use a Power BI to do something. And then have your categories of spend, your traditional biomed. So maybe if you're doing, you got to go to your ERP and you're generating POs out of your ERP. Maybe you have B for standard biomed device. Maybe you have a prefix of I or something like that in the beginning. You got to figure out a strategy. I like to break out glassware, detectors, tubes, anything associated with those types of items. I want to make sure I can identify how much we're spending on it. Clinical lab gear. Anybody doing like clinical lab stuff? Not centrifuges and stuff. That doesn't count. But again, clinical lab. I don't do a whole lot of service with our own hands in the clinical lab on the large analyzer, but those contracts are all entered into the enterprise asset management software, because I want to give leadership the whole picture, not just some of the picture. I want to be the single source of truth for medical device management information. So all of these things, if you do, who's responsible for consumables? Batteries and cuffs. That's interesting. In the olden days, it did a lot of that, right? Came through biomed. So that's cool. So that's different. But just try to capture that stuff so you know where your spend is. And it makes you better, right? It makes you a better leader, a better technician to know what you're spending and how you're spending. Because then you have a little bit of skin in the game, right? You like to do well, right? I like to accomplish. I like to show my employer that I'm doing what they think I should be doing. I don't want them to, hey, what have you done for me lately? Because you can save them $10 million and, 2 months later, they're like, what are you guys doing?
Does your EAM, does it track the acuity of the contract with parts only, full service?
Correct. All the entitlements, right? Is glassware included, is it not included? What are the hours of coverage? Is it 8 to 5, 8 to 9, 24 hours? Your EAM, CMMS, should track that. You should be able to have that in your enterprise asset management software. If you don't, start looking. Or maybe go ahead and.
I just had a quick question. Are you concerned with where your parts are coming from? So like, what if COVID taught us a little bit of something? It's onshore your parts or do something like that. Because if you have a contract with and say we can't get the part, you're still up the creek. So
100%. So Lynn's question was, am I concerned where my parts are coming from? Yeah. Now, how to control that, right? So, if it's a Siemens, sometimes it's like, oh, it's in Germany. Well, that doesn't happen. But if it's under a full service agreement with Siemens, they're not going to allow me to go buy it from Block Imaging or somebody like that, right? Although they're owned by Block. See that? That was a bad example. But anyway, first call, or something like that. But yeah, so Chinese manufacturers, right? And no disrespect to anybody in the room, but so I'm worried about the supply chain of countries that the U.S. we're dealing with, right? We're dealing with Middle Eastern countries, Israel, interruptions to supply chains due to maybe war or conflict. I do worry about that. The Chinese, obviously, I always worry about stealing, stealing data. So we are a mind rate shop. We are mind rate patient monitoring. We're standardized on mind rate anesthesia. But remember in the beginning, I said, hey, you know what? That's who my employer said they wanted to go with. I wasn't there at the time. I have to manage it. Manage it. So we do business with them. They, mind rate was heard the concerns as well. We're probably one of their larger customers in the United States. And they moved their manufacturing to Malaysia. So now they have not Chinese manufacturing in China, but it's over in Malaysia. Is that safer? I don't know. But then I have products like Order that Ben has, and there's other products, but there's products like that healthcare technology management is involved in, and that helps out with my cybersecurity posture for the medical devices that are in my inventory. It's a big deal to me. I do an integration with my enterprise asset management software and my IoT IoMT solution. Because what I want to do, Ben's product listens to the traffic on the network, and that traffic on the network has a make, model, serial number, operating system, MAC address, IP address, and when there's serial numbers that match that Ben's tool is capturing in my enterprise asset management, I'm going to pull all of that information into my software. I want, again, my HCM software to be the single source of truth because I want my cybersecurity team to tell me. Now, the cybersecurity team at your facility, they have your IP address, right? They'll know, hey, I have an IP address. Maybe they know it's a radiology device, but they don't know it's a CT scan or an MRI, cath lab. They have no idea. So what they do is they come to our system. They have access, full read-only access. Not they can't use something in the system, but they have read-only access. So if they see an anomaly going on somewhere, they can see exactly what's going on. They know the building it's in, the location of the building, because now they have it in my CMS. Believe me, they're not tracking it on their side, right? It's more of a spreadsheet kind of thing, for that. So anyway, we're done on that slide, right? So now it comes time to talk about selecting your business partner. As I indicated, it is a big deal to me who I partner up with. Because, if I'm using, even the OEM, whether you're making a decision to buy service on, for instance, a great example, one of my facilities, we bought a Siemens biplane device, brand new. Doctor had to have it, Dr. Tank had to have it. So Dr. Tank gets his biplane neurointerventional lab. It's dull. Right out of the gate, it's dull. There's lots of service. And we call Siemens for service during the warranty period. But I have great directors. I have great team members. And because I pound into their head, Ben and I were talking last night, I pound into their head, we document everything, right? We document everything. So as it's getting closer, so now we're like 9 months in, and we've had, significant downtime. Dr. Tank's unhappy. So, they call the corporate guy and they are bitching and moaning, they're complaining. All right, I'm going to get Siemens in the room. We're going to get us in the room. We're going to get Dr. Tank in the room. We're going to get everyone in the room. We're going to talk about it. So Siemens blue suits come in and blue dresses come into the room. And I got, my CEO in the room, my COO in the room. They were that invested in it as well. Great. Always great to have C-suite in your side, at your side. So I had Dr. Tank there and his staff in the neurointerventional room, the primary person that was the lead tech, if you will, and then my biomed director. Okay? So Siemens whips out, look guys, you've only had 7 service calls. But Ryan whips out his spreadsheet. Now we've documented 38 service calls. So even when they called applications, so probably a lot of times you folks may not even have a clue that your department upstairs is calling application support. Guess what? In my world, they can't do anything with regard to service, like they can't buy service, they can't generate a PO. We actually generate POs ourselves, which is, pretty cool. They can't, like if they need support, let's say it's out of warranty, they'll call us, but we're immediate. Even if it's on call, we're immediate. We can give POs like that. So all of a sudden the Siemens guys were like, whoa, wait a minute. So they looked through the list and we explained, we went line item by line item. And we had Dr. Tank and Rad Tech supporting it. I mean, because they knew, they remembered when that call was placed. So they said, what do you do? What do you care about? Just sign a contract, you don't have to worry, right? We're gonna take care of all that. I said, because that's not the point. Right? We want a system that operates damn near 99.9% of the time, right? Because we're doing patients, we don't want to stop in the middle of the case. Dr. Tank doesn't want to get interrupted during the case. You wouldn't want to do it if your mother or father or child or loved one. So why should we tolerate that? They said, okay, we're going to give you 6 months additional warranty. Right? Great. They flew an engineer in from Germany. He found a problem. The local service engineers and the SME from Cary, North Carolina, they couldn't find a problem. The guy from Germany found a problem. I didn't sign the service contract with GE. Signed the service contract with the third. And Siemens was beside themselves. Because number one, they thought they had me over a barrel. They thought I wouldn't do it. I go to Siemens. But we did it. We never had any, I mean, we had, little problems and stuff like that, but we never had another, it wasn't, maybe a couple of times a year, we'd have a table going up and down type of thing or something like that. But yeah, not a problem. So anyway, just another example. I had Hill Run beds, right? Baxter Hill Run beds. We had brand new beds. And that service engineer was he was there every day. And again, great. Why are you worried about that? We're fixing it. We're there every day. But I don't want you here every day. So I wound up calling her in North Carolina. I called down there. You know what they did? They sent an engineer out. And she came out and went over the bed. They found a manufacturing problem in the bifurcation, the plastic bifurcation that sends the air into the different cells inside the mattress. They found a manufacturing defect. They went ahead and fixed that and replaced all of it. And then we had no problems. But if you don't take that extra step and go that extra mile, they wouldn't be fine. Hey, you got a service engineer, who cares? You're okay. We'll throw 1 million of those things in. No, I don't want you to throw 1 million of those. So what happened? I want, whether it's an OEM or a third party, when the stuff hits the fan, and the stuff will hit the fan, I don't care if it's OEM or third party, and I turn around, I want to see my business partner, right? We're business partners. I want to see them behind me, stand behind it, get it fixed, get it done. Can you visit the facility? I talked a little bit about that. I love visiting the facility. I want to see who, if you're so lucky to have that opportunity, take the opportunity. Yeah, I don't want to be at a point where I got to constantly look over their shoulder. Are they doing the right thing? Another example, ultrasound system. OEM came in to do a PM on it. And this was a facility that I wanted to get my team into the imaging equipment. It was an ultrasound system, but it was still had the OEM come out and do a PM on it. And I tried to introduce myself. And I said, hey, I wanted to buy fans for the staff because I wanted to bring ultrasound in there. So I said, hey, what fan are you with? What fan are you using to do your? He said, oh, we use a fan. I said, oh yeah, I know you use a fan. What fan? I saw him scanning this garage. I said, what fan do you use? It's in the car. You're doing the PM now. Where's it in the car? He didn't use a fan. You can bring the family in with him, it's heavy, right? It's heavy. So, so that caused the hair on the back of my neck, that's all I had. That's all, that's the only location I have it now. But the hair on the back of my neck stood up, and I said, wait a minute. Back to my office, wait a little while, then finish up the PM. I was going to use it as a teaching exam. I came back out and was finishing up, collecting his stuff, and one of my technicians had the ultrasound system, he's ready to wheel it upstairs, right? We're going to get back to radiology right away, get that system back in service. And I caught him by the eye. He's like, so he walked away from me. Yeah, see you later, thanks for your help, appreciate it. After he left, wheeled the ultrasound system in the middle of the floor, had my technicians gather around. I got down on my hands and knees, and I pulled out the filter for the power supply. And guess what? It looked like crap. There was so much dust and lint. So I used, what was that?
Like a lint trap out of a dryer?
It looked like a lint trap out of the dryer, exactly. So I used it, said, folks, this is why we have to own. We have to take responsibility. Those folks put their pants on the same way you do every morning. There's nothing special about those folks. You can do this. We'll get you the training, but you can do this. Don't be intimidated by this stuff, because these are our patients. You know what? That person that just came in and did it, he didn't look at it as his patients, right? And that's what I talk about, like going to the facility and talking to the staff in the back. Do they think about the patient, right? If they're just putting together the scope, or there's somebody, family member is going to be on the other end of that scope one of these days. So I just try to use it as a teaching moment. And that's why your relationships with the vendor is important. And I texted a company by the name that starts with Philip. Starts with P. And I texted the zone VP, and he was all defensive of the tech. Well, I appreciate that. You didn't, number one, you didn't stop and think, and you didn't think to call that person. But I sent pictures. I said, look, man, I'm not making anything up. But it was their reaction to that. I was like, you know what? Ooh, they're not my business partner, right? They're just in it for the money.
You'd be on a right to repair.
Are you investing in your career? Are they investing in your career field? Here we are at HTM Mixer in Scottsdale, Arizona. I do go around the expo, and I look at the manufacturers that are in there, because I look, to the earlier slides when I'm trying to figure out who I'm partnering with. That the ISO 1345, that's great. But also, if they're supporting my career field, then my staff, I'm gonna, I'm gonna give them a real good hard look, because I'm gonna support them too. Because they're spending money. It costs, we're sending guys like Ben, and Jeremy, and there's a lot of vendors that spend a lot of money on hotels and flights, and paying John Krieg and MB Publishing for the booth space out there. That's the sacrifice. I want to reward their sacrifice by doing business with them, if I can, and it makes sense. So, here. Check the health. So if they don't have 1345 or ISO or something like that, what does their QMS look like? So, especially some of the younger, they're just as passionate as companies that do have ISO 30, but they don't have a budget, and I get that. But if they're passionate, like obviously I'm passionate about my career, I'm gonna give them a shot. And have they shared their data with you? So, we want to know how many callbacks they have on their repairs and things like that. Good? Any questions? Keep going.
Do you guys utilize any quality and supplier quality?
Say again.
Do you guys do any supplier quality audits? Do you have a group that does that? in your organization?
We have a group that does that. We have. I say, we do have corporate, like, we have corporate people, like, analysts, as we call them. And I'll bring them to an MDX show or an AU meeting, and, bring them into the presentations, and we'll sit there. And, there's some of you that have amazing support staff behind you. And, we'll go into a presentation, we'll go out. You got 5 guys doing what you, in addition to your other duties, that's what you're doing. It's pretty cool. But yes, obviously we do look at that, failures, there's lots of failures of parts, right? We got a part in from Chicago from a major default vendor. And the way it was packaged in that box was a fan. It was a fan for, I think, an X-ray system or something like that. It was a packing in here. So Lord knows, as it traveled through FedEx to our location, what kind of damage was going on. And we took pictures of it and sent it to that default vendor. So now you got a program in place. Now you got a real cool sourcing program of who you're going to do business with for your parts. You're starting to come along. Now when you sit back and relax, I'm all done with that. Well, no. To your point, you better start monitoring. What are the outbox failures, right? If you're using one of those companies that brokers parts, so your staff has a link in the software. It's the easy button that goes out and it sources parts from them, and the parts come in. Are you monitoring all of them, right? Are you monitoring your invoices, right? You as a leader, periodically monitoring your invoice, making sure that the billing is correct, that they're not double billing. You gotta monitor. Are you meeting the goals? Remember in the beginning, I said set goals. You want to, maybe it's a financial bogey, which is good. But again, you want quality along with financial results. Because if you're only getting financial results and you have nothing but headaches because stuff is failing prematurely, that's not a good solution. Always assess quality. Has your strategic sourcing partner taken the foot off the gas pedal? Okay, so, right? So in the beginning, they wanted your business, right? Woo-hoo! They're throwing all kinds of resources at your account, right? And then all of a sudden, little things start to leak through. Like, the quality's not even good. They're coming out when they feel like coming out. They're not coming out when you need them to come out. You got to monitor that. You got to really pay attention to make sure that, again, I'll go back to the value proposition, right? You're entering into this relationship. They're gonna make a profit off of you, and we're gonna save money and have high quality repairs, right? That's the value proposition. And you want to make sure they're hitting the target. Again, I'm not a cheap guy. They've got to make money, right? Because you want them to invest into their employees, right? They have lighting bills and heating and air conditioning bills they got to pay. So you want them to make money. That's not a bad thing, right? But I get crazy sometimes. I see, I want it for the lowest cost. Well, and I think you're going to be disappointed a few times. Here's a big red flag, right? Especially today, in today's market. Has anything changed? Company sold to venture capital or private equity? Has leadership transitioned, right? They whacked the CEO because everything rises and falls on leadership, right? So you got to pay attention. If there is a leadership change, that's okay. Maybe it's a retirement or something like that. That's okay. You got to really monitor it. Don't take your foot off the gas pedal. Keep monitoring. But this company sold or venture capital. Big deal today, right? Because those folks are making. I had a conversation today in the hall with somebody that is high up in a company that was acquired by venture capital a few years ago, and there's issues. there's black spots. So, pay attention. All right? I hope I gave you a few nuggets and where I'm at. I'm like right on time. Oh, no, 4:15, 4:01.
You got a question over here?
Yeah.
I just wanted to emphasize, that assessment and monitoring piece, if you yourself on an ISO 9000 or a DNV accredited facility, that's a regulatory institution.
That's an
So
outstanding.
you've got to be, doing at least an annual assessment.
Yep. Yep. And your complaints, are you following up on your complaints? And your document, right? It's not enough to follow up, but you got to document it, right? You got to document it. So DNV, that's kind of cool with data.
Yeah, I think a lot of us do like quarterly business reviews, but it's partners like that. But I like, the big net that you shared earlier about the health assumptions. And, maybe we do those quarterly business reviews, but how often are we doing that 2% audit behind just after they come through? Because I've had it at where we had a platinum service contract with the famous, Nemo machine name that's out there. And same thing, I could go behind it and, hey, the face shield moves, or the compression's off, or, any number of other things, just because they have to recall or the gate temperature or whatever it is, they're not part of that.
Wes, that's a great point. I had the opportunity to come in, it was a totally outsourced program to an OEM provider, or, multi-bidder provider. And, I was hired a year before the end of that contract. So I had the wonderful luxury of going in, taking a look and seeing what they're doing. And I looked at their FTE count at my facilities. We had about 29 facilities. And I looked at their FTE counts. I'm like, dude, there's no way they are doing real PMs. There's no way, look, I started out as a young biomed in the trench doing biomed stuff. So I know all the tricks and I get it. But I'm looking at their FTE count, I'm like, no way, dude, there's no way. So the next QBR, next quarterly business review, I questioned it. Oh, but Chris, we have regional resources because this vendor also happened to manufacture patient monitors, and the staff that's in the hospital could not touch the patient monitor. If it was a broken patient monitor, they had to call the regional service guy to come in and fix the patient monitor. I thought that was a stupid business plan, but that's the business plan. But, of course, we have regional. There's so many resources. I was born at night, but it wasn't last night. So I started looking at this. I started monitoring. I had a year. And at the next QBR, Wes, I said, you know what? Which hospital is your flagship in our organization? Who do you think is doing it the best from your perspective? So they told me who. Now, I've been in the company now for a while. I knew the CEO down there at that hospital. We knew a bunch of other folks, so I called Ken, who's the CEO. I said, Ken, hey, look, I want to come down and I want to do like a joint commission audit on our service provider. Awesome. Come on down. And I knew the facility, so I came in and went right upstairs to the ICUs. And this program had stickers, PM stickers. I don't like to use PM stickers in my program. So, but this big OEM company uses PM sticker. It wasn't just in minutes that the first couple of devices I started looking at expired stickers, and so I saw one of the biomed guys come into the unit and said, hey, you have the director, yeah, they'll call her. Calls her, she comes up, she's got sneakers on, a Monster drink, walks into the ICU with an open Monster drink. I say, I have a copy of your MEMP. She looked at me like I had 12 hands. MEMP, what's that? And in her defense, she came from the UHS rental company. That was her, what her background was. So she didn't know what MEMP was. I did get an MEMP several days later, but it was from somebody else, but it was an old, outdated. So you can see where I'm going with it. Here's a big vendor, right? They can do no wrong. You don't get fired for hiring this vendor. You know what I mean? Everybody knows what I mean? Right? You choose this vendor, of course you're not gonna get fired. They're the giant, they're the behemoth in the industry. So after we took over the whole program, right? We gave them another, right? We were gonna bring it all in-house. They did let me hire. I wanted to negotiate that in the exit, can I hire? And there were a few, because there was a guy in one of my Florida hospitals, every QBR was, every time he asked questions, he knew the answers. Like he knew his inventory, I love that. When I asked you, certain things about your inventory, he knew the answer. Because there were a lot of other people in that position that I asked, they had no idea what I was talking about. No answers for it. So I did hire a couple of those folks. And then after we transitioned, I went to them and I talked to them. So we were swamped. We weren't doing PMs. It was horrible. It was horrible. So I took a lot of your, Okay.
You talked about equipment acquisition processes and stuff like that. What do you do when it breaks down and something shows up on the dock that you did those purchases?
That never happened.
Yeah. It's a good question. At UHS, we had such a program that was humble, like nothing came in that we didn't know about, for the most part. I'm sure, from time to time, something would come in. But, from a parts perspective, and service provider, that could never happen. But a new device, very, very rarely, because we were so dialed into the purchasing process. I was on the value analysis committee, so rarely.
So you're saying you should be okay.
You should be on the capital. Yeah, nothing happened at UHS, it was UHS. Now, I am, in my title as the CHS, I am medical equipment capital is in my title. So it's really just specific to medical equipment capital, but that doesn't mean like radiology, right? But we do have radiology people that do supply chain stuff. And next thing you know, I hear there's a United Imaging MR coming into my Tucson.
They signed a contract for new injectors, and we gotta get them all, so.
I'm like,
Because of the consumables.
oh, United Imaging, MRI. What's United Imaging? Who are they owned by? The Chinese. The Chinese. Thanks for. So, I'm 8 crack at this point. I'm like, how the hell does that happen? How the heck? Because, a couple months later, I was talking to our CFO, and I talked about the risk associated with Chinese manufacturers. And I used United Imaging as an example. And he was 100% behind me. He said, no, I agree, that's a risk, especially COVID. He's talking about COVID. That's a risk. So you try to lock it down as much as you can. Hopefully, I'll progress a little bit more at CHS. There's a lot of little kingdoms and fiefdoms and silos yet to be found. But, Mike Buster here had a question.
Yeah, so first, more so, not a question, but more so, I like your fact about the vendors or suppliers that you're using that, they've got to make money too. They're not going to stay in business, as well as we looked at, when I was at Intermountain, we looked at it from a perspective of, we need to create a win-win for both organizations. Win for them, a win for us. Because if I just beat you up on a price and just price, guess what's going to happen?
hospital down the road is gonna pay
Yeah.
if I need to do this, because that organization still has to make their money. We deliver this
Well,
money.
you know what else I do? Tell me if you think this is a true statement. So you beat the crap out of it, and you know what? They relent, right? Okay, we'll give you that price. But you know what? Remember the stuff hit the fan, and the stuff hits the fan, and you want a little concession out of them, or something like that? You know, no, don't be a concession. You know, I talk about the meatball, right? So I was in a situation up in Missouri. I had relocated from Pennsylvania to Missouri with the Sisters of Mercy. And the reputation that the GE guys had in Missouri, they do the 411, right? Oh my God, this guy's coming to the Sisters of Mercy hospitals in Missouri. We had 6 or 8 hospitals, and I was going to lose one. We're all going to be out of job. We're all going to be out of job. He's going to bring imaging in-house. We're screwed. And, you know, I wanted to do imaging in-house, but I wanted it to be a win-win. And me and the regional service leader decided to take his team and my team out for barbecue. My service engineer, my imaging service engineers, and his service engineers, because this rumor had continued to swirl, and I felt tension. I felt like there was tension. And so we all went, and you know what? They all learned, you know, this one has a kid going to college, and there are things in life. Life is important. And if it's a win-win that Mike talks about, everybody can send their kid to college if they want to send their kid to college or trade school or something. You know, it works for all of us.
And I worked, at that point, I referred through the supply chain, and I had a vice president of supply chain that sat down, and in a team meeting, we were going through some things to talk. He said, listen, everybody that we do business with is grouped into 2 categories. They're either a supplier or they're a vendor. And he said, vendors are no different than popcorn sellers and hot dog sellers at ball games. They exist for a reason. You need them, but you want less of the vendors because they exist on a transaction-only basis.
Yes.
You want less of them than you want suppliers. So suppliers collaborate with us in order to create those win-wins and drive healthcare costs down for the
They
consumer.
respect your mission. They sign on to your mission and respect your mission. But yeah, so what happened, you know, we did our own imaging service in-house, and guess what? In Missouri, we're big hunters in Missouri. And the first day of deer season, what went down? My CT and my ER. And my CT guy was out hunting. So I called GE in. They came in at like, oh gosh, it was 4 o'clock in the morning or something. Needed an X-ray tube replaced. Replaced the X-ray tube, calibrated, was back up and running by 9 o'clock in the morning. So very little downtime. And I kept on looking like for the invoice to come in because that was overtime, right? I had to pay for that. I kept on looking for the invoice. So I called him. I said, Brad, where's my invoice, dude? Because I want to get it in this month. You know, I'm going to pay the bill this month. He said, don't worry about it. So what do you mean? I said, look, you guys. So they would store parts at our facility instead of renting a shed somewhere. They would store the parts, and they had key access 24 hours a day to it. And sometimes they'd have an install going up in Bolivar, Missouri, and they needed a part. And one of my guys, we had 6 minivans to drive around in Southwest Missouri. We put it in the minivan, we drove it up to them, so they didn't have to leave the install. And it was that relationship that won. Things like, dude, don't worry about it.
We did that same thing in Intermountain when we were building the in-house program. We brought the GE service engineers and our in-house engineers all together for a team building session one day. It was a full day. And when we first started, the GE service engineers were sitting on this side of the room, and the in-house engineers were sitting on this side of the room. And they weren't talking. It's like there's that divide. By the end of the day, they were all intermingled because of the the commonalities that they had and everything else.
They realize we're all the same, right? It's like soldiers in war sometimes, you know, it's, you know, when it's Christmas and they break bread and they all go back and fight again. Ben, so,
But I really want to drive home the point you made about letting the data decide. Well, first of all, you have to have the data, right? But we tracked parts quality, so DOA rates, wrong part deliveries, late part deliveries, to kind of rate our vendors. Well, consistently, one of those vendors that didn't score well was the meat club.
yeah,
Okay. On the flip side of that, we had for a while, we had a third-party service or third-party organization doing our scope repairs, right? And again, we collected the data and looked at failure rates between the ones that we had Olympus do and this other organization do, and the failure rates were double of that other organization. And so what money are you saving, right? But again, we collected the data and we let the data decide.
yeah, it takes all the emotion out of it.
It does.
Takes all,
Absolutely.
you know, one thing I didn't stress or talk about, like I'm always monitoring the top, in my case, it's the top 25 because we're such a large, I have the top 25 vendor spend on a dashboard, even for my senior leaders. So they can see who are top 25 that we're spending money with. You may just do a top 10 or something like that, but they can see who we're spending money with, right? And they'll ask questions. Why are we spending so much money with that organization? And I had answers for it, why we're doing it. And, you know, we might target some more service contracts to drop or, you know, it just, again, it gives you got to have a plan. You got to have a mission to really be effective. If you can't go in half-cocked and think you're going to get it right. Ben?
One of the trends I noticed at HIMSS last year around, you know, picking a strategic partner for devices, it was that a question to ask is, do you require any license key at any point of the life cycle of these devices? So what I've been seeing, there's some OR OEMs, right? That's 6 years, 7 years into after it leaves. But when the day it leaves the manufacturer, it knows 6 years from now, that's going to require an OEM manufacturer key to keep working. So it can disrupt your, you know, your investment recovery program. Your equipment may not be worth anything at that point. So it's a way for them to push to either get investment to, you know, have action from that key, for those keys, or push them out of the, you know, industry. You're no longer competing against yourself. So I would look 5 years, 6 years, 7 years down the road. Are there any license keys required at any point of the life cycle of this device that it's shipping with? Is a good question to ask.
Yeah, so Al mentioned right to repair, and I think that's kind of along the same line because, you know, we all like to bitch and moan about right to repair. These vendors are killing me. And, you know, what can we do? The government saved me, help me, you know, pass a law. The government's not going to come in and save you. So I believe you have the power today to be saved. Be saved yourself. However, you know, somebody else, you gotta be in the purchasing line. You gotta have a seat at the table. That's the only time that you're going to be able to make that difference for your employer, the company you work for. And even if you're a third-party provider, you're TriMedics or Philips multi-vendor or something like that, sometimes you serve two masters. I get it. You got to serve, you know, your company, but serve the company that is contracting you for that service. If you know about that, of course you might not want to do it for your own company, but if it's for those other companies, if you know about that type of situation, advocate for your, because that's that value proposition you bring. That's why they hired you. Wes?
I think you bring a good point. I still think legislation is necessary because we should not yield to rules. It should just be a standard. You know, we do business with a handshake. Instead, I got my hand in my pocket and put my hand out and shake your hand. So we can be reasonable with each other. We both have a win-win situation. You know, but when I've got to constantly remind the same vendor that, hey, you're coming out to service 2 sterilizers and you're giving me a $1,300 charge for travel for each.
Yeah,
And
yeah.
technically, it's
He already here.
Yeah.
I could go on Turo and rent a Bentley for $300. I can hire a driver at $50 an hour for all day for 8 hours. That's another one. So for $700, I can have your technician chauffeur all day long in a Bentley for less than what you're charging me for travel.
I was invited to speak to the Italian Society of Clinical Engineering in Catanzaro, Italy. And the subject that they wanted me to talk about was AEM, the alternative equipment maintenance, and how we handled that, you know, with the Centers for Medicare and Medicaid. And the guy that presented right before me was from the EU director. He was the medical device guy from the EU director. So he stayed and listened to my presentation. Because in Europe, there's no right to repair. They have to follow the manufacturer's specification. There's no AEM. They were so locked in on me about how you're doing it, what are you doing, how are you trying to get the EU, the FDA or the CMS, how are you trying to get them to buy into, and that was the gist of my presentation. But the EU director guy came up to me after the whole thing, he's like, give me his business card, he wanted to learn so much about it. I don't know where they're at today, I haven't put my finger on the pulse there, but, you know, the engineers that were in the audience were thirsty for them. They would love to be engineers instead of robots, right? Because my tech, I had a tech one time, he was a bachelor's degree engineer, BSEE, and he was doing PMs on a fusion pump, which is okay. But man, he followed every step of the book. And I walked over to Greg and I said, Greg, that test that you just did that ever fail? It was like a stupid. I said, I've never had one fail. I probably PM tens of thousands of drugs. I've never seen it fail. Why do we do that? Because the manufacturers said that. But, you know, the ability to accept risk is a beautiful thing, and CMS does give that ability, and we go to our PE committee now, not our EOC committee anymore, PE committee now, and we tell them, we give them the data-driven decisions, right? Why we're going to eliminate these steps, or why we're going to change the PM frequency, or why we're doing what we're doing. And if it's rational, they say, yeah, do it. So, but good point, Wes. Thank you. Well, I've kept it longer than you need to. But I appreciate you coming.